I'm John Whiteside, the Chief Executive Officer at SageWest Healthcare. Look out the window. You guys can't see right now, but I'm looking out the window, and what drew us here? Mountains, outdoor, animals, big sky, great people. I can list a whole bunch of things, but what a fantastic place to come in. The opportunity to raise our family here, but most importantly, giving back to this area, giving back to the citizens of this county, and to improve healthcare in Fremont County. I was commissioned when I was 22 years old in the Marine Corps as an officer. Was promoted to become a corporal and a sergeant, so you progressively pick up leadership skills and leadership positions. And then one day I had the opportunity to go back to college to become an officer in the Marines. So that was starting the journey of leadership. So something that sticks out in my mind is I had a Marine that had never gone to college, didn't have a lot of opportunity. And as he progressed through the ranks, helped open up some doors for him to apply to college. I wrote a letter of recommendation for him to go into college, and he was the first in his family to go to college. And without presenting opportunities that I had to him, he probably would have never done that. And about 5 years later, he wrote me a really great letter. It was old school snail mail letter that said thanks for all this and what he had become. And it really meant a lot to me, because without that, he would have never done that. Giving back to this country, serving our country, and defending the Constitution and defending freedom. I like influencing healthcare in a small town setting. As a leader in healthcare in a rural area, we're not providing care to just one person. We're providing healthcare to an entire community. And for Fremont County, that's a lot of people that would normally have to drive 2 hours to another facility. So it's rewarding to me that we can keep care local. We're providing jobs, but we're also keeping people healthy, along with possibly life-saving interventions. Stability. I want to be here. I chose to be here. Wasn't assigned here. And I think that is something that the county deserves, the hospitals deserve, and most importantly, the patients deserve. Learning people's names, learning people's faces, and learning a little bit about everyone that works here. That has been my main priority, is kind of getting to know people, because it's hard to build camaraderie if you don't know each other. And it's great to hear everyone's story and why they came to this hospital, why they've stayed at this hospital, or listening to some of the complaints that they have. Because the only way to grow, the only way to get better, is to listen to some of the challenges that we have. And so the last couple of weeks, that's been a lot of that, a lot of talking, a lot of listening, and coming up with how we're going to make things better, or showcase the great things that we are doing. And I think sometimes people focus on the negative and they forget that we've been here throughout COVID. Some of the things I'm doing, getting out there, trying to put my face out there, try to put our name out there, try to remind people of why we're here and the services that we provide, and listen to them on what services they would like to bring back to this community. There are certain things that we're never going to do. There are certain things that we should do. Bring services to this community, but more importantly, showcase what a great place this is to work, what a great place this is for patients to come to. And we already have doctors that want to be here. Nothing else comes before patient care. We need to provide quality, ethical care. We need to keep it local. And most importantly, we need to be the first thing on your mind whenever you're sick. Come to our hospital, we will get you well.